Imagine you've just had surgery, or maybe you've just delivered a baby.
Oh, that exhaustion is so real.
Right. Every single muscle in your body aches. The hospital bed was super uncomfortable. The stress has been, just off the charts.
Yeah,
And
absolutely.
you want nothing more in the entire world than to sink into a deep hot bath, or maybe sit in a sauna to just sweat out the lingering
I
exhaustion.
mean, that sounds like heaven in that moment.
It does. But before you leave the hospital, a nurse hands you a discharge pamphlet. And right there, under the recovery instructions, printed in bold, aggressive letters, is one word: no.
It is just the ultimate disappointment when you're that exhausted. I mean, we culturally view heat as the ultimate healing
Yeah,
comfort.
we really do.
Yet modern medicine treats it like a profound biological threat in those early days of recovery.
Well, welcome to today's deep dive. Our mission today is to figure out the definitive truth about this, honestly, universally punishing medical rule.
It feels punishing for sure.
It really does.
Right.
We are focusing on one highly specific question today. Should you avoid hot baths and saunas after medical treatments, surgeries, or childbirth?
And we have a lot of data on this.
We do. Our stack of sources today is incredibly wide. We're pulling from post-operative medical guidelines, postpartum recovery protocols, clinical cellular biology research on wound healing, and even data on infrared thermal therapy.
Because to really understand why a soothing soak is strictly forbidden, we have to look past those surface level instructions.
Right.
We need to look at the physical mechanics of what heat actually does to a compromised body.
So let's unpack this. Let's start with what these guidelines actually mandate, because the consensus in the sources is completely unified on the ban.
It's across the board.
Yeah, across vastly different medical disciplines, heat and soaking are blacklisted. I mean, take a LALTZ procedure or a colposcopy, for instance.
Right, so for context, a LALTZ procedure involves using an electrified wire loop to remove abnormal cervical cells. It essentially leaves behind a highly vulnerable, localized burn and cut on the cervix. So the guidelines for that procedure state absolutely no baths or hot tubs for a full 4 weeks.
Wow, 4 weeks. And the sources show similar strictness for a DNC, which is a dilation and curettage, where the uterine lining is scraped after a miscarriage or for diagnostic reasons.
Exactly. Because you've got raw internal tissue there, the restriction is typically 2 to 4 weeks.
Yeah, and some doctors advise patients to wait until their next entire menstrual cycle has passed.
And it gets longer for bigger surgeries. For more invasive procedures like abdominal surgeries, hysterectomies, or repairing a vaginal prolapse, the timeline extends to 4, 6, or even 8 weeks of absolutely no hot soaks.
Wait, but it also applies to non-surgical procedures, right?
Oh, yeah, absolutely. Even after something like a vaginal rejuvenation laser treatment, which, uses light to stimulate collagen, the strict rule is to avoid any exposure to heat and saunas for at least 72 hours.
Okay, but hang on, let's look at this, because these pamphlets contradict themselves in a pretty massive way.
How so?
Well, I'm looking at the very same discharge papers that forbid baths, and almost all of them clear you to take a shower after just 24 to 48 hours.
I see what you mean.
Right. If the issue is simply getting the surgical site wet, why the double standard? Like, you can shower, but a bath is suddenly a medical emergency.
Okay, that double standard actually points us to the real culprit here.
Which is?
Water itself isn't the primary enemy. The true enemies are the heat and the mechanics of a prolonged soak.
Oh, interesting. So it's not the wetness, it's the soaking in heat.
Precisely. When you stand in a shower, warm water simply runs over the skin and falls away. The ambient temperature of your body's core doesn't drastically change.
Right, because you're just standing in the air.
Exactly. But submerging yourself in a tub of hot water or stepping into a 140-degree sauna, that fundamentally alters how your circulatory system behaves.
Okay, so if the water isn't the trigger, but the temperature is, what is that intense heat actually doing to the wound underneath the skin?
Well, to see the damage, we have to zoom way down to the cellular level. We need to look at the very first stage of healing.
Okay, lay it on me.
Wound healing is a highly orchestrated process. It begins with what's called the hemostatic and inflammatory stage.
Right, the inflammatory stage.
Yeah. This covers the first 0 to 3 days after an injury or a surgery, though, for deep incisions, it can last much longer.
Makes sense.
In this phase, your body goes into a state of high alert. It rushes specialized white blood cells, specifically polymorphs, which are your first responders, and macrophages, which act like a cellular cleanup crew, straight to the area.
To fight off bacteria and clear away dead tissue, right?
Exactly.
But how does the body physically get those white blood cells to the surgical site so
It
fast?
uses a mechanism called vasodilation.
Vasodilation, okay.
Yeah, so the smooth muscles in the walls of your blood vessels physically relax, allowing the vessels to widen and expand. And heat is one of the most powerful external triggers for vasodilation.
Okay, let me make sure I'm visualizing this correctly. So think of your blood vessels like a multi-lane highway leading to the site of your surgery.
I like that analogy.
Right. Under normal conditions, traffic is flowing steadily. When you get injured, your body naturally opens up an extra lane or two to get emergency vehicles, those white blood cells, to the scene.
Perfect, yes.
But when you get into a hot tub, you are suddenly opening up a dozen extra lanes all at once. You get a massive, uncontrolled influx of fluid rushing into the area, creating an absolute traffic jam.
A traffic jam is a great way to picture it, because the vessel walls don't just widen, they become highly permeable.
Meaning they get leaky.
Yes, exactly. They get leaky. That excess fluid from the traffic jam literally seeps out of the blood vessels and into the surrounding tissues.
Oh, wow.
Yeah, and this leakage causes edema, which we commonly call swelling.
But some swelling is normal after surgery, though, right?
It is, yeah.
Mm.
But heat-induced vasodilation creates a drastic excess of it. That sudden, massive volume of fluid puts agonizing physical pressure on the delicate, newly forming tissues.
Oh, that sounds awful.
And more importantly, it compresses the raw nerve endings around the incision.
So it's essentially suffocating the area with too much of a good thing.
Exactly. And the nervous system's response to that heat makes the situation significantly worse.
Why? What does the nervous system do?
Well, the sources dive into the role of TRP channels, specifically TRPV1 and TRPV4. These are specialized, temperature-sensitive receptors embedded in your nervous system.
Wait, so my nerves literally have a built-in thermometer.
They do. And these specific channels are designed to trip like an alarm system when they detect temperatures above 107.6 degrees Fahrenheit.
Oh, wow.
Yeah, so when you expose a fresh, vulnerable wound to high heat from a bath or a sauna, those TRP channels activate.
And let me guess, that causes more pain.
A lot more pain. They don't
Right.
just register the heat. They send massively amplified pain signals straight up your spinal cord to your brain, and they trigger the local release of inflammatory neuropeptides.
So let me get this straight. Getting into a hot bath creates a brutal feedback loop.
It really does.
The heat dilates the vessels, causing a localized flood of swelling. The swelling puts intense physical pressure on the nerves, and the heat simultaneously activates the pain receptors.
Yes, all at once.
So you are left with a bright red, throbbing wound and significantly amplified pain.
That's the internal chaos, yes. But submerging yourself in water introduces a massive external threat to the structural integrity of the wound, too.
Okay, what kind of threat?
We have to talk about the bacterial playground.
Ugh, a gross phrase, but highly accurate.
Yeah, it's not pleasant. The sources constantly emphasize the catastrophic risk of infection.
Right, because warm, moist, dark environments are the ultimate breeding ground for bacteria.
Exactly. When you combine the intense heat of a bath or sauna, the sweat your body naturally produces to cool itself down, and an open or newly stitched incision.
The risk of a severe infection just skyrockets.
It does. And physically, prolonged soaking does something called maceration to the skin.
Maceration. Is that the medical term for the burn effect? Like when you stay in the pool too long and your fingertips get all white, wrinkled, and soft?
That is exactly what maceration is.
Oh, okay.
See, the outer layer of your skin is made of dead cells called keratinocytes,
Hmm.
which are packed with a protein called keratin.
Right.
They act like a protective brick wall.
Hmm.
But when you soak in water for a long time, those cells act like microscopic sponges.
Oh, no.
Yeah, they absorb the water, swell up, and the structural mortar holding them together basically turns to mush.
So if that tissue gets waterlogged and soft, it seems like everything holding the wound together would just fail.
It does. The structural integrity of a newly healing incision is incredibly fragile.
Right, because it's brand new skin.
Exactly. If the surrounding tissue macerates, surgical glues can literally dissolve and peel off prematurely.
Yikes.
Stitches can pull right through the softened, mushy skin. Scabs can wash away before the delicate new tissue underneath is ready to be exposed to the air.
You are actively stripping away the body's natural bandages. And this brings us right back to the double standard with showers. Showering is fine because the water hits the skin and immediately runs off before those keratinocytes can absorb it.
Right.
But soaking in a tub is a disaster because it turns the tissue into a sponge.
So if you soak in those early weeks, you're simultaneously increasing internal swelling, dialing up the pain receptors, inviting aggressive bacteria, and dissolving the structural integrity of your wound.
That is a perfect storm for surgical complications.
It truly is.
So, by this point in the deep dive, heat sounds like the ultimate villain. Avoid it at all costs. But the sources present a massive paradox that we really need to figure out.
The twist.
Yeah. If heat is so biologically destructive, why are infrared saunas and hot thermal therapy is heavily marketed right now as elite post-surgery and postpartum recovery tools?
It's a great question.
Like, how can heat be the villain that ruins an incision, but also the hero that heals it?
What's fascinating here is that the shift happens when we move out of the acute phase.
Okay.
The exact same biological process of vasodilation that causes so much harm in the first few days becomes your greatest ally in the later phases of healing.
Which are the proliferation and remodeling phases?
Right.
Proliferation meaning the body is actually building new tissue.
Correct. Once the wound is physically closed, meaning the skin has fully bridged the gap, the stitches are out, and the acute inflammation has subsided, your body shifts gears.
It's moving into construction mode.
Exactly. It is no longer trying to plug a leak and fight off bacteria. It is trying to rebuild a permanent, resilient structure. And to rebuild, it needs raw materials.
So opening up those highway lanes with vasodilation is suddenly a very good thing.
Widening those blood vessels later in the process brings a massive influx of fresh, oxygen-rich blood and vital nutrients directly to the site.
And that helps the tissue.
Massively. The heat stimulates cells called dermal fibroblasts. These are the cellular factories responsible for producing collagen and elastin.
Which we love.
Yes. That is what physically rebuilds the tissue and improves the long-term elasticity and appearance of scars.
The cellular mechanics described in the sources are really fascinating. Like infrared heat specifically activates something called heat shock proteins, or HSPs.
Yes, heat shock proteins are incredible little molecular chaperones.
What do they do?
Well, proteins inside your cells have to be folded into very specific, complex 3D shapes to function correctly.
Right.
The trauma of surgery, or just the stress of the injury, causes many of those proteins to misfold or unravel.
Okay, so they're broken.
Basically, yeah. But when your body encounters the elevated temperatures of a sauna, these specialized heat shock proteins are triggered.
Oh, so they react to the heat.
Yes. They rush in like cellular mechanics to physically refold damaged proteins, clear out cellular debris, and restore function to tissues that were traumatized.
That's amazing. And on top of the protein repair, the heat also triggers the release of nitric oxide in the blood vessels.
Nitric oxide is a potent vasodilator, but it also changes the behavior of the vessel walls.
In a good way, I assume.
Yes. In the later stages of healing, this improved microcirculation acts like a high-powered garbage disposal system.
A garbage disposal?
Yeah, it sweeps in and clears out the lingering metabolic waste, the dead cells, and the chronic, stagnant fluid that often sticks around long after a surgery.
We actually see this working incredibly well in the postpartum data.
Oh, the postpartum study is fascinating.
Yeah, one of the clinical sources looked specifically at women who had perineal lacerations after childbirth. They compared a group that used infrared thermal therapy against a control group that just used standard iodine care.
And the results were striking.
They weren't just slightly better, they were staggering. Within 2 days of starting the therapy at the appropriate time, obviously the infrared group showed a mean healing improvement score of 31.7 compared to only 15.0 for the control group.
Wow.
Right. The heat essentially doubled the visible healing metric.
And the pain reduction is equally notable. Another study tracking far infrared therapy showed that over 90% of women reported mild to no pain by their 6th week postpartum.
90%.
Yeah, but the key to all of this success is that the heat was perfectly timed.
Which is the most important part.
Right. It wasn't applied when the wound was fresh, bleeding, and vulnerable. It was applied when the tissue was ready to be remodeled.
So what does this all mean? Which brings us to the most practical question for the listener. If heat is a villain in week 1, but a hero in week 6, how do you actually navigate this timeline?
It can be confusing.
Like, how do you know when you've crossed from the danger zone into the healing zone?
It is a waiting game, honestly. And the rules of engagement depend entirely on the severity of the vascular trauma your body has endured.
So no guessing.
No guessing. Instead, we can look at how the medical timelines group different procedures based on their depth.
Okay, let's go through them. For minor, superficial skin procedures like having a mole removed or a simple surface biopsy, the vascular disruption is pretty minimal.
Right.
You generally need to wait 2 to 4 weeks before hitting the sauna or submerging in a tub.
But as you go deeper, the timeline extends. For cosmetic surgeries that involve separating layers of tissue, like liposuction or a tummy tuck, the wait is 4 to 6 weeks.
That makes sense.
And if you are looking at orthopedic surgeries, like a knee replacement, you have to consider that bone was sawed and massive, deep vascular networks were disrupted.
Ouch. Yeah.
Those require a minimum of 6 to 8 weeks.
And major joint revisions can push to 8 to 12 weeks. Cardiac surgery, like a chest bypass, requires 12 weeks or more because you are dealing with the core of the circulatory system itself.
Exactly. It's all about how deep the disruption went.
What about the postpartum timelines?
Well, for postpartum mothers, the standard recommendation is to wait 4 to 6 weeks after a routine vaginal delivery before submerging in a bath or using a sauna.
Okay.
But if you've had a C-section, you are dealing with deep abdominal incisions cutting through multiple layers of muscle and fascia.
Which is major surgery.
Exactly. That requires a strict minimum of 6 weeks and often much longer, pending a physical exam.
The overarching rule here is that you do not try to diagnose your own tissue remodeling.
No, absolutely not.
You wait for your doctor to physically look at the incision and give you the official green light.
That is step 1.
But here's where it gets really interesting. Let's say the doctor finally says, yes, the wound is fully closed, you are cleared. You can't just run out and jump into a 140-degree sauna for an hour to make up for 2 months of lost time, right?
Oh, please don't do that. That would be a huge shock to the system.
So how do you actually ease back in?
Well, your body has been through a major traumatic event, and its ability to thermoregulate, to effectively manage its own core temperature, might still be compromised.
Okay, so take it slow.
Very slow. The sources provide strict, phased reentry protocols to keep you safe.
So what's the safe reentry protocol?
You have to start small. The clinical recommendation is to begin with brief 10 to 15-minute sessions.
Just 10 minutes?
Yeah, and if you are using an infrared sauna, keep the temperature lower, aiming for 120 to 140 degrees Fahrenheit. You want to observe how your vascular system responds to the vasodilation before you push your limits.
And we absolutely cannot ignore the hydration rules, which the sources treat as an absolute non-negotiable requirement.
Hydration basically dictates the success of the therapy.
Why is it so crucial?
When you sweat in a sauna, your blood volume drops. A drop in blood volume decreases circulation, which is the exact opposite of what you are trying to achieve for wound healing.
Right, you want the highways open, not closed.
Exactly. To keep the highways open, the strict rule is to drink 8 to 12 ounces of water before the session, another 8 to 12 ounces actively during the session, and 24 to 32 ounces after you get out.
And there is also a highly specific protocol for postpartum mothers who are breastfeeding.
This is very important.
Right, because sweating heavily in a sauna means you are losing fluids that your body desperately needs to manufacture milk.
Yes, your body is working overtime.
So, if you are nursing, you have to add an additional 24 to 32 ounces of water to your daily baseline intake just to replace what the sauna takes out of you.
Furthermore, the sources explicitly state that if you are breastfeeding, you must wait at least 2 hours after a sauna session before nursing your baby.
Wait, really? Why the 2-hour delay? Does the heat change the milk?
It's not the heat itself, but what the heat moves.
Oh, because of the garbage disposal effect?
Precisely.
Yeah.
Remember that infrared therapy mobilizes metabolic waste, lactic acid, and cellular debris from your healing tissues into your bloodstream so it can be filtered out.
Okay, so it's all circulating in your blood.
Yes. You have to give your liver and kidneys a couple of hours to filter that mobilized waste from your blood so it doesn't end up concentrated in the breast milk.
Wow. That perfectly illustrates how powerful thermal therapy actually is.
That's not a joke.
It isn't just making you sweat, it is actively moving waste and fluid through your entire systemic circulation.
Yeah, which reinforces exactly why you cannot use this intense therapy when your body is already overwhelmed by acute surgical trauma in week 1.
It is a profound tool, but its effectiveness relies entirely on respecting the body's timeline.
Absolutely.
Well, let's bring this all together. If you're listening to this right now and you are currently lying on the couch, incredibly uncomfortable, recovering from a procedure, and dreaming of a hot bath, the definitive answer is that you absolutely must wait.
You have to hold off.
Yeah. In those early days and weeks, intense heat is going to trigger massive vasodilation. It will cause localized flooding and swelling. It will trip your TRP channels to intensify your pain. And if you submerge the wound in water, you are inviting aggressive bacteria and literally dissolving the structural integrity of your new skin.
It's just not worth the risk.
Yeah.
But the light at the end of the tunnel is that once your doctor confirms the wound is permanently closed and the acute inflammation is gone, that same heat becomes a powerful ally.
It really does.
It will boost collagen production, activate heat shock proteins to act as cellular mechanics, and flush out lingering waste to accelerate your final stretch of recovery.
So the secret to thermal therapy isn't the temperature, it is entirely about the timing.
Timing is everything. And this journey through the cellular mechanisms of healing leaves us with an interesting broader perspective.
I think so too.
We live in a culture that is heavily focused on biohacking. We're constantly trying to force our bodies to perform better or to heal faster using extreme hot and cold therapies.
Always looking for the shortcut.
Always. But perhaps true healing isn't about overriding our biology with immediate life hacks. What if the most advanced elite recovery tool we possess isn't a high-tech infrared sauna, but simply the patience to honor our body's ancient, perfectly timed internal intelligence?
You can't hack the foundation while the concrete is still wet. Thank you for joining us on this deep dive. Keep asking great questions, keep challenging the pamphlets they hand you, but most importantly, give your body the grace to heal on its own schedule. We'll catch you next time.